Welcome back to Two Gals in a Glass Half Full. Today, I'm really excited. You're going to want to stay tuned. We have Dr. Davis here with us. He's a cardiologist and #1 New York Times bestselling author of the Wheat Belly series and Super Gut, both amazing books. But before we get started, Dr. Jess, what is in your glass?
So I'm working on my morning smoothie. I keep getting busy, and then I still haven't had finished it yet. So that's okay. Still working on that. But got all sorts of like stuff added in: chia seed, flaxseed, protein, microgreens, all the fun stuff to like really get a good boost of nutrients for the first thing in the morning. So Dr. Bobbie, what's in your glass?
So I'm a little embarrassed to say when I woke up this morning, I realized yesterday I had zero water, zero, which is not normal. So I'm already on my second glass, almost done of it, of water. I'm trying to make up today for what I did not do yesterday.
There we go. That's okay. Hey, you know what? Like today's a new day. So keep
Yes.
moving.
I normally don't ever go having zero water, but this morning I woke up and I was a little like, and I was like, I had no water yesterday. Oh my goodness.
Yeah. All right. And then with us today, we have Dr. Davis. And before we do his intros, Dr. Davis, what would normally be in your glass?
Well, I was drinking coffee that I added 20 grams of collagen peptides, bovine collagen peptides, and sometimes a little bit of hyaluronic acid. These are two things, by the way, that people have largely abandoned and consuming because we've been told this ridiculous message to cut your fat and cholesterol, which is nonsense. There never was any evidence to support that. It's been codified into dietary guidelines and widespread practices. So it's when people abandon organ meats as a result, they lack collagen and hyaluronic acid, two factors that have major influence on the way you look, your body shape, your abdominal fat, your muscle mass, as well as metabolic factors like blood. So I put that in my coffee with a little bit of natural sweetener, like a little stevia or monk fruit or allulose, and a little bit of prebiotic fiber, like inulin. So it's delicious.
Absolutely.
Sounds
And
good.
like in that one glass, you're getting so much done. Like that's the cool thing when you add stuff together and make it a little bit more complex, then it's like you're really getting a good bang for your buck, and that time spent for drinking it. So I love that. Absolutely. Um, so Dr. Davis, can you tell us a little bit, like a little bit about you? Like what's your why? Like why have you really gotten into some of this like awesome stuff that we want to learn so much more about?
A lot of the paths I've taken are because of huge blunders I've made, not from some great insight, but just making big mistakes. One of the mistakes I made many years ago was I became a low-fat vegan because I heard Dr. Dean Ornish talk about this and how he claims to have reversed heart disease. He did not, by the way. He misinterpreted the data, used some flawed methods, and if you die of heart disease, that's not reversal of heart disease, right? Or if you have bypass surgery or a heart attack, that's not reversal of heart disease. But I did that with me and a bunch of patients. What I saw was dramatic metabolic deterioration. I became a type 2 diabetic as a low-fat vegan, biking, jogging, playing tennis, all the time. In my 30s, by the way, so a number of years back, about 30 years ago. But it illustrated to me how awful the wrong diet could be. And then my mom, so I was doing angioplasty and stent implantation, aborting heart attacks, those kinds of things in the cath lab in hospitals. And my mom died of sudden cardiac death after her two-vessel coronary angioplasty. So here I'm doing those kinds of procedures, realizing I had wasted my time, 17 years of education and training to do something that was essentially a crime, essentially useless. So I set my path to change and help people identify how could I have said to my mom, hey, mom, you're going to have a heart attack or die in 2 years, in 3 years. What can we do today? Of course, the conventional answer is sheer idiocy. It's take a baby aspirin, take a statin cholesterol drug, reduce your dietary fat and cholesterol and saturated fat, and exercise, which we help publish these data. So one of the things we were doing was tracking coronary disease via CT heart scans that generate a coronary calcium score. That's how you identify heart disease, by the way, a coronary calcium score. Calcium being a surrogate for total atherosclerotic plaque volume. Well, if you do nothing, when you have that scan, you're given a score. Normal is 0, no plaque, no calcium, no plaque. But people come through. These are people like you and me, going to work, riding your bike, going to the store, going to school, whatever, and you have no, but you have heart disease hidden, a little time bomb, right? So let's say your score is 400, which for a woman in her 40s or 50s would be very high. And that means she's going to die or have a heart attack or have other terrible event within about 5 years, guaranteed. So what happens if you do nothing? Well, that score increases 25% per year. It's horrifying. Imagine your investment account grew at 25%. You'd be Bill Gates in no time. But it's back, right? So what if you take a baby aspirin, a statin, cholesterol drug in high dose, cut your fat and cholesterol, exercise, eat healthy? How fast does it grow? 25% per year. My colleagues to this day call that optimal medical therapy. It's absurd. It's laughable. Yet that's the standard of care. So I had to set myself on the path to try to, because I have thousands of people at this time in Milwaukee about 30 years ago, trying to help them stop because they're all panicking and going to my colleagues who say, oh, don't worry, we'll do the real test, the heart catheterization and preventive bypass or stent implant, which, by the way, is malpractice because it's been shown to have no benefit to do these kinds of things in people with no symptoms. These are not people in the emergency room. These are you and me going to work, going about your business, and putting us through major procedures. Why do they do that? Because it pays so incredibly well. It's not uncommon for a bypass procedure to make the healthcare system $150,000 a pop. And my colleagues can do 3 or 4 a day. So it makes a huge amount of money in professional fees. And so it perpetuates this fiction that procedures are somehow the solution for it. They're not. But it set me on a new course. And for instance, when you reject cholesterol testing, this ridiculous outdated thing called cholesterol testing should have been discarded decades ago. When you do the more advanced, more reliable testing like lipoprotein, the method I used was nuclear magnetic resonance, NMR, lipoprotein test. There are other methods. You see right away that heart disease is a disease of diet, period. There's no pot of gold for the pharmaceutical industry when you really understand the causes of heart disease. And the things that cause the number one driver of heart disease risk is small LDL particles, because small LDL particles are oddly persistent in the bloodstream. They last for days and days and days and goes around and around and around in your circulation, adding to atherosclerotic plaque accumulation. They're oxidation prone, they're inflammation prone. What foods cause this number one cause for heart disease? Wheat grains and sugars, not pork fat, not bacon, not butter, not olive oil. Wheat grains and sugars, amplified by inflammation and insulin resistance, the poor responsiveness of your body to insulin. Those are easy to correct, very easy to correct. Yet the world is all focused on cholesterol and statin drugs because it makes a lot of money for the pharmaceutical industry, and there's nobody coming to the doctor's office advocating for diet and change and those kinds of things. But there is a good-looking woman or guy in a three-piece suit hawking drugs, like statin drugs. And so we have this tragedy that heart disease is incredibly easy to stop, put a stop to. Well, why would you? When your hospital just put a $75 million new wing for heart disease procedures. So there's very little incentive. So that's why when you pull back the curtain on healthcare, as you two know, you realize it has nothing to do with health. Healthcare has nothing to do with health. It has all to do with revenue generation and profit for healthcare insiders.
Yep. 100%.
Yeah. Dr. Jess and I feel very, very strongly kind of about what you're talking about and how we're just missing the boat on like getting down to the root cause of all of these, you're talking about heart disease, but in diabetes and things like that. Like there's so much if we get down to the root cause to make changes. But it also requires people being willing to change their diets. And sometimes that's a hard.
Yeah, I think it seems like I was just talking to somebody this morning about this actually. It seems like it's so multifaceted when we're talking about change, like actual change that's consistent in the lifestyle. So one, your whole value system needs to change, like number one. And so how can you change somebody's value system if they've got outside influences telling them that they don't need to? So they can take this pill and this pill is going to make them healthy, right? And so then you have somebody else that's saying, listen, like, this is really important. Like this, there's a lot of research. I can give it to you. I can break it down for you. I can make it nice and easy to understand. But there's like really, these lifestyle changes are like really, really important and accessible and possible. And you can do this. I'm willing to support you. Let's get some people on your team that can support you. And but when we have this outside influence of saying like, no, 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 just take these pills, it really makes that lifestyle change that much harder, because it's already going to be change, which is difficult for, I mean, us as humans, we just don't do change very well. It's just how we like what's comfortable. We're going to follow that path of least resistance. It's, would it be easier for me to grab something prepackaged in the morning rather than make a smoothie? Yeah, that would be much faster. However, my value system, which is how I make my decisions, is what ends up, like making me spend that energy or that time, or my husband does, and then I drink it.
Well, and then another
Yeah.
thing with that, and Dr. Jess, you can kind of speak on this. Another thing I find is, Dr. Jess and I are physical therapists. And a lot of times a patient will come, well, my doctor says, and Dr. Davis, as we were talking earlier about colleagues and just different mindsets and different ways of practicing. So it's hard as a physical therapist to encourage someone to do something when their doctor said they just need to take this medicine. And so making that change, as Dr. Jess was saying, it's multifaceted, and sometimes they will put more people put doctors up here, on this line that are telling them to take all these meds and not really looking at kind of what others down below are saying and doing.
Mhm.
If that makes sense.
Yeah, which is why we do these podcasts. So then this is going to be recorded. So now when I have that patient that's like, well, my doctor said I could just take the statin, I'm like, hey, I've got this episode that I would love for you to listen to. Make that information accessible. Absolutely. So Dr. Davis, I love that you've used this knowledge through personal experience to actually push forward and do things to help people actually start to get that understanding. I'm really curious. So you ended up writing that book, and it's one that I've been very familiar with for a while, Wheat Belly. So I'm just curious, like, what was your experience with like coming out with something like this that's so, to me, like normal, but like it's not. Like, here you are, this like cardiologist that's like out here saying all this different stuff. Like, what was that like? How were you received?
Well, so it started with my efforts to eliminate the expression of small LDL particles for people with heart disease. That was my practice, was trying to prevent heart disease. But it led to all kinds of other experiences. For instance, one of the turning points for me was a 38-year-old school teacher who came to my office for a relatively trivial issue, that is palpitations. It turned out to be a lot of nothing, just benign blips in her heart rhythm. I kind of reassured her, but she'd sit there clutching her abdomen in pain. And I'd say, wait, what's wrong? She'd say, well, it's my ulcerative colitis. It's acting up again. I've had it for 12 years. I'm on Asacol, prednisone, and a biologic. She was a school teacher, so not making a lot of money. Her husband was a policeman, and she was paying $4,000 out of pocket for the very expensive biologic she was getting, and it wasn't working. She was hemorrhaging and getting blood transfusions every 2 or 3 months. So her gastroenterologist said, it's time to remove your colon. And so you ladies know that is a crippling process. You're going to have an ileostomy, a hole in your abdomen where you empty poop and it makes noise and stinks in your 30s. So I told her, hey, you're here just for palpitations. So you and I have not gotten into a conversation about diet, as I do with most of my patients when they have coronary disease. So let me talk about that. And I told her how we eliminate wheat grains and sugars and do some other things. And she said, no. They biopsied me twice for celiac disease. They did all the blood work. I don't have celiac disease. I said, I understand that. This is not about celiac disease. I said, give it a try. They're going to remove your colon, right? She says, okay. And she does it. She comes back 3 or 4 weeks later. I said, tell me what happened. She jumps on the table and says, my ulcerative colitis is now gone. It took a week, but all the diarrhea and bleeding stopped within a week. I stopped the first drug. I stopped the second drug. She subsequently stopped the third drug. She said, "You didn't tell me I'd lose weight. I lost 38 pounds." And so she was transformed. She goes back to her gastroenterologist, who I knew, and he said, she goes and says, "Hey, I am cured. And look at me. I am healthier than I've been in a decade." And he says, "What did you do?" She told him. And he said, "It's a coincidence. Go back to what you were doing." So that was one of the turning points for me. When my colleagues encounter cure or miraculous change in health, and rather than saying, "What did you do? Did I overlook something? Am I not understanding it?" Rather than saying that out of curiosity and helpfulness, they just say, "It's a coincidence. It's stupid." They just, and I saw this over and over and over again when I turned type 2 diabetics, for instance, into non-diabetics, or people on 4 blood pressure medicines having ideal blood pressure on no medications. I saw this over and over again. And so it became clear the solution will not come from the doctors. In fact, they are obstructionists in the process of regaining health. They get in the way. That was why I ended up writing a book called Also Undoctored, because I recognized that people don't get healthy by going to the doctor. They do it by taking on a lot of these things on their own.
Mm-hmm. Oh yeah, no, I mean, there's been many instances in my past where I had to figure it out for myself and say, okay, well, there's logic and reason here. Let's look for a pattern. Let's look for what's going on. Let's see what, like if I can find something I can alter, make a plan for, and then see if it works. Because it's the same thing. Like I was having all sorts of GI related issues, and they were like, "Oh, well, you don't have celiac, so it can't be gluten." Ah, however, it was actually. And so all I did was just like write down everything I ate for a couple of days and figured out the common denominator, took it out, and like felt way better. So it's like it's these things that like there's so much logic and reason that if we can just find like this, I feel better like this, it probably makes sense. I feel worse with this, it probably doesn't make sense. And guess what? It doesn't matter if somebody's telling you, no, you don't feel like that. It's like, yes, I do. Like, I'm the one living in this body. Like, this doesn't make any sense. It's just silly sometimes. But we are influenced. We're so influenced by people that we perceive to have more knowledge than us, more power than us, more whatever than us. We put value to those words and to those opinions. And that's I mean, because we kind of have to, because at some point in time we do need to listen to people that know more than us. So how, like, trying to kind of weed your way through the healthcare system could be very difficult. I mean, I know I find it difficult sometimes, and like I'm in the system. So it's can be very frustrating. So what kind of, as far as like research goes, like, so did you conduct your own research? Did you kind of come into any studies? Like, how did you end up kind of really putting together, like, I feel confident that these are the changes that need to happen?
Well, let me tell you about an experience I've been having. It's going to sound like it's off topic, so forgive me, bear with me.
That's okay.
So I recognize, and the science is quite clear, that the human gastrointestinal microbiome has been devastated by all the things we've been exposed to, like multiple courses of antibiotics, glyphosate, the herbicide and Roundup that's sprayed all over wheat and other grains and other foods, chlorinated drinking water, stomach acid blocking drugs, non-steroidal anti-inflammatory drugs, preservatives, emulsifying agents, all sorts of things have decimated our microbiome. Among the effects is loss of some very important microbial species, such as Lactobacillus reuteri, Reuteri, named after the German microbiologist who discovered it in 1962 in the breast milk of a breastfeeding German mother. In his 40-year academic career, by the way, he found it increasingly difficult to find it anymore. He couldn't find it in breast milk, couldn't find it in stool. It essentially disappeared. This has been corroborated since. This one microbe, among others, has been nearly lost completely. What happens? What happens when you restore this microbe? Incredible things happen. You lose abdominal fat. You have a restoration of youthful musculature. But you get the musculature that you had in your 20s. Your libido goes up. Males have a 50% rise in testosterone. Older women who have vaginal atrophy regain vaginal moisture and sensation. There's deepening of sleep. There's many effects mediated by the hormone oxytocin, such as an increase in the intensity of love and affection, increased generosity, increased acceptance of other people's opinions. There's a decrease in appetite, particularly for snacking. There's an increase in hopefulness, in generosity, and liking people better. In other words, it transformed people's health. So, but the crazy thing is, I tell my audience is largely female, and the ladies say, oh, okay, for the empathy and generosity and libido. We don't care about that so much. We really care about better skin. Because one of the effects of restoring rhodori is a loss of skin wrinkles and an increase in sebum or moisture. So I did a small clinical trial just to validate this and show everybody. So we did it, small, 25 ladies, and we said, please don't change your diet. Please don't change your exercise routine. Just take, this was Lactobacillus rhodori at high counts, and I threw in marine sourced collagen peptides, hyaluronic acid, those things lost because of low-fat nonsense, and then also the carotenoid, astaxanthin. So I just said, take these 4 things, and we're going to make some measurements over 90 days. And so we measured, for instance, something called high-resolution skin ultrasound. It's a way to measure dermal thickness. For those ladies ladies know an awful lot about skin, I know. But you may recall it's the epidermis we see on the surface of dead skin, but it's the dermis beneath, the dermal layer. That's the seat of skin health and appearance. So we recorded a 15% increase in dermal thickness, which is unprecedented. If you take collagen alone, for instance, for 90 days, you get about a 6 to 7% increase. So it's a very significant increase, 6 to 7%. We got 15%. But we also happened to measure in this skin clinical trial waist circumference. And we saw dramatic reductions in abdominal fat, an average of 3 inches, no diet, no extra, nothing. 3 inches as much as 8.5 inches. Even more incredibly, there was almost no weight loss. Well, consistent with the animal evidence, consistent with my large human evidence, we're experiencing a marked increase in muscle. So recall, we lose about a third of our muscle mass as we age. And of course, if you lost weight by cutting calories, you've lost even more. So we're restoring lost muscle. And of course, that restores your metabolic rate. And it gives people incredible control over weight. So I stumbled. Now, this has all been highlighted by the recent nonsense with the GLP-1 agonist drugs like Wegovy, Ozempic, Mounjaro. So someone pays, it's incredible. Let's say a woman pays $12,000 for a year's worth of Wegovy. She loses 40 pounds. She's real proud. She looks 10 to 20 years older, by the way, because she's lost subcutaneous fat and muscle. But she lost 40 pounds. She's fitting back in a size 8 dress or whatever. Of those 40 pounds, 10 pounds is muscle. Well, think about 10 pounds of ground beef on your kitchen table. It's a lot of muscle. So 40 pounds lost, 10 pounds muscle, 30 pounds fat. She stops drug because few people can afford that kind of money forever. Stops drug. She regains 32 to 34 pounds of fat. Now she's more pre-diabetic, more likely to be a type 2 diabetic, at higher risk for heart disease, dementia, breast cancer, and other diseases, more at risk than she was at the start. So she paid $12,000 into pharma's pocket to become less healthy at the bidding of her doctor. This class of drugs is an absolute disaster. But the pivotal issue here is the loss of muscle. So I stumbled on a way to preserve muscle or even increase muscle. Personally, so when I did this a number of years ago, particularly restoring rhodori, in my 60s, I gained 13 pounds of muscle and my strength increased by 50% over 3 weeks. Going to the gym, I don't know about you guys, I hate the gym, can't stand it. So I go 15 minutes once a week, but I gained 13 pounds of muscle, increased strength by 50%. So we're seeing, in effect, think about this, smoother skin, restoration, youthful muscle, increased libido, preservation of bone density, enhanced immune response, acceleration of healing, deepening sleep. We're turning the clock back 10 or 20 years, and that's what we're seeing. So this has kind of sparked a new conversation that we've got to stop talking about weight loss. Let's talk about shape and body composition instead, including preservation or restoration of youthful muscle.
When you say that, I just think of the benefits of more muscle, like less falls, better balance. And to be honest, if you're stronger, like you're going to do more. If you feel better, if you can move easier, most people are going to then continue to be more active, which is just this. I feel like you either have a cycle where you're just kind of going down, or you have a cycle where you're going up, and you got to kind of choose which cycle do you want to be on, because there's no such thing as static in life. It's changing. It's either changing and getting better or changing and getting worse.
You know, there's the shocking thing here is there's more than ample evidence to tell us that if you cut calories and lose weight, you are going to have a lot of health problems. This has been borne out numerous times. A lot of the research is from the NIH, National Institutes of Health. They conducted a recent study, for instance. They took very heavy people, BMIs of 50 or greater, so really super obese people, put them on a very drastic calorie reduction and exercise program, 2 hours a day, strength training and aerobic, 2 hours a day, 6 days a week, which is incredible. That's a lot. For 6 months, they did lose 123 pounds, of which about 17 pounds was muscle. So they lost less than the expected amount, which is more like 30 pounds. So they blunted it, but they also reduced their metabolic rate a huge amount. So much so that they calculated that they'd have to take in 400 calories per day in order to maintain weight, the lost weight. Of course, nobody can do that. That's starvation. And so that's why, like the Biggest Loser study, also conducted by the NIH. So you guys know these people are tortured, low calorie, extreme exercise up to 6 hours a day, sobbing, right, crying, because it's awful. But they did lose 70 pounds, 130 pounds. And then they were followed after they left, in this case, the 8th season, and they all regained all the weight and more, and their metabolic rate dropped by 27%. And they regained all the weight despite low calorie intake and exercise programs. So we know with good evidence that we could call cutting calories move more, eat less. We could call it use smaller plates to make portion size look larger. We could call it a GLP-1 agonist drug. We could call it a bariatric procedure that shrinks your stomach by some means, but they're all variations of the same thing, cutting calories. We now know with good evidence, cutting calories is a trap set that guarantees long-term weight regain and deterioration in health. So I think what we have really is a way to circumvent all that nonsense and all the problems associated with conventional weight loss methods.
Yeah. And I think like a big point that you were making as well is that when we work on the microbiome and we actually think about how our system is interconnected, then it's not only are we getting the benefits of improved skin, right? As well as improved muscle, decreased weight, decreased risk of like pretty much all chronic illness that takes out a lot of people in this country and in this world. So it's really having that concept of like, it's actually a little bit more complex than this math of like calories in, calories out, and I've had patients even as of this week have been advised that they just, postmenopausal women, it's tough, right? You need to eat less. As of this week, I still have women being told this, and it doesn't make any sense because they are eating less. And I'm like, no, I am not a nutritionist. I cannot put you on a specific diet, but I really need you to, I've got some really good referrals that I would love for you to talk to them, because it is not that simple. Our bodies don't work like that. Our bodies are interconnected. So I love the what you brought up about the skin aspect of it, because I think that's something that it is a little bit unexpected, right? So we think of like, oh, skin is just on the outside of our body, and I think we forget that skin is a functioning organ, and so it does need health. So like, what is your just overall like perspective on like, why do you think that happened? Like, why do you think that you're like able to get that dermal layer to increase with being able to improve, with these like specific like probiotics and some other things?
Well, obviously, Lactobacillus reuteri is just one among thousands of other species, but that's the first microbe I started playing with many years ago.
Yeah.
By sheer dumb luck, blunder again,
Right.
I made the mistake of picking probably the most interesting and important microbe of all. Two major reasons. One is that reason that it takes up residence in your GI tract and sends a signal via the vagus nerve to your brain to release the hormone oxytocin. And oxytocin is the primary determinant of your shape. and body composition. It's oxytocin that's responsible for the increase in lean muscle mass, the reduction of abdominal visceral fat, the increase in testosterone in males, the improvements in behavior and personality and sociability, all via oxytocin. But there's another aspect, even beyond this incredible thing called oxytocin. It also, this microbe, Lactobacillus rhodori, is unique in that it colonizes the small intestine and colon. Most microbes are meant to colonize the colon, but Lactobacillus rhodori colonizes the small intestine also, 24 feet of small intestine, where it takes up residence and produces what are called bacteriocins. These are natural antibiotics effective against fecal microbe. Why is that important? Well, half the US population, because of our overexposure to antibiotics, emulsifying agents, preservatives in food, etc., have lost numerous beneficial species. And in their place, fecal microbes have ascended from the colon. So small intestinal bacterial overgrowth. The overproliferation of fecal microbes like E. coli and Salmonella in your small intestine. Well, the small intestine is not prepared for this. It's very permeable because that's where you're supposed to absorb amino acids and vitamins and minerals. But when fecal microbes come to inhabit, trillions of them inhabit the small intestine where they live and die rapidly. Microbes only live for a few hours, not years. And so fecal microbes turning over rapidly in the small intestine die, release some of their toxic components. One is called endotoxin. That endotoxin enters the bloodstream through the very permeable small intestinal wall, and that's called endotoxemia. So modern people who have this situation, which is about 150, 160 million of us, it's a lot, have this situation where there's a 200 to 400% increase in the level of this endotoxin in your bloodstream. And that causes expansion of abdominal fat. It causes accumulation of fat in your muscle, so-called myosteatosis. It causes erosion or loss of muscle. It causes insulin resistance and inflammation, and a whole host of other problems. Restoring this one microbe, this one little microbe lost by nearly everybody, turns this all around. It reduces endotoxemia because it colonizes small intestine, produces bacteriocins, and produces oxytocins. What do you have? What's the net result? Younger, more slender, more muscular, a better human being who looks and feels 10, 20 years younger.
Yeah. So I'm super curious, like if we wanted to add this to our diets, like do you have recommendations? Like where would we go about finding something that's reputable that, actually there's a lot of supplements out there. Some are good, some are not. Do you have any recommendation of where we could find to like add some of this stuff into our coffees, our foods?
So one of the things we have to pay, and this is kind of tedious and boring, but one of the things we have to pay attention when we play with microbes is strain. So to illustrate, we all have E. coli in our guts, but what if you ate lettuce contaminated by cow manure and E. coli? Well, you could die of that E. coli. Same species, different strain. So we have to pay some attention to strain. So the strains that work are, for instance, one is a commercial product from a company called BioGaia in Sweden. And the product is called Osfortis. I'll be producing a microbe also in the very near future, make it available to people. Because what we're doing, you can take it as one of the most useless class of supplements is probiotics. People think that probiotics are the solution to gut health. They are not. Not to say they're worthless, but these haphazard collections of microbes. Throw this species, throw this species, really, it's going to get better over time as people who formulate probiotics get smarter. But one of the things you must restore is Lactobacillus rhodori. So we get it as commercial products, the BioGaia Osfortis. There's a company called Cutting Edge Cultures that has a product called L. rhodori Superfood, and I'll be coming out with a product also near future. What a lot of people are doing, though, is fermenting it. Now, we ferment it as something that looks and smells like yogurt. It's not yogurt. You can't buy it in the store, but it looks and smells like yogurt. We're going to take Lactobacillus rhodori. We're going to use my method of prolonged fermentation. So if you made yogurt in a factory or at home, you're going to let it ferment for 6 to 12 hours. By ferment, that's making microbes reproduce. They don't have sex, right? There's no male and female microbes. They just reproduce themselves. 1 becomes 2, 2 becomes 4. So we take rhodori, we let it reproduce 12 times. Rhodori reproduces about every 3 hours at human body temperature. let it ferment 36 hours, 12 doublings. I perform flow cytometry on the yogurts. We get about 300 billion per half cup serving. And now that's one microbe. You can ferment other microbes too. But this, and you eat this yogurt with some chia seeds and stevia or whatever, and you get these effects: smoother skin, restoration, youthful muscle, amplification of the immune response, acceleration of healing, increased testosterone, restoration of vaginal moisture, preservation of bone density, all those things from eating a yogurt.
Yeah, but a specific yogurt, which I think is key, because it's like when you look at, like you go to the store and you look at like the probiotics on the on the counter, it's like, well, which one? Is it the one that has the fanciest packaging? Is it the one that like there's so many different marketing strategies that can be difficult to truly understand, and as a layperson, and so that's why it's like, it's again a number one reason why we love doing these podcasts, is because we get to talk to people that truly do have a good understanding of what's going on and can give some actually like reliable recommendations that are out there. So as far as like, everything that you were able to kind of like stumble upon, which is really cool, what have you noticed over the years? Like, what have you added and figured out of like, oh, this combination and that combination, because you're talking about collagen and some of this other stuff. So like what are all of these different factors that you consider to be work in harmony to help our physiology function at its highest?
Well, I think that combination I came up with, and by the way, all the things we're doing, we're not treating anything.
No.
We're restoring factors that have been lost or absent from modern diet. So rhodori we've lost because of antibiotics, et cetera. We restore collagen and hyaluronic acid because people stop eating organ meats. They do crazy things like eat boneless, skinless chicken breast, which is completely nuts. And they get their food from a fast food restaurant or a drive-through window. You have no idea how that food is prepared. It's probably not organic. It's probably heated on a plate with corn oil. All kinds of garbage comes through. And one of the casualties of modern processed and ultra-processed foods is the loss of carotenoids: beta-carotene, lutein, zeaxanthin, cryptoxanthin, and astaxanthin. Astaxanthin is the pink or orange color in lobster and shrimp. So we restore those four factors, specifically lactobacillus rhodori, collagen peptides, hyaluronic acid, and astaxanthin. And that four combination that I did formulate as a product achieves all these incredible effects, because all we're doing is restoring things that you've lost. Your great-grandmother had them, but we don't. We've lost them. Restoring them, and you get this incredible synergy in effect.
No, I definitely love that. And as far as like, like other lifestyle factors, so it's like we've got the, like adding some stuff in to make sure that we're restoring. But what are some of the lifestyle factors that you've noticed that are also important?
So my basic programs prior to all this effort with the microbiome was simple: no wheat, no grains, no sugars. Never limit fat, never limit calories, never limit calories. Maybe do for a short time if you want to, like a time restricted eating or intermittent fast. But in general, cutting calories destroys your health. So we don't cut calories. We never limit fats. If you want bacon, go ahead. If you want to eat the fat in your pork, go ahead. Never buy lean cuts of meat. Never buy low fat or reduced fat dairy. Buy full fat. Use more butter. Use more cheese. Use whole milk or cream. And when we make, by the way, the rhodori yogurt, I use organic half and half. You don't have to use dairy. If people don't like dairy, you can use other things like coconut milk. There's some additional steps you have to go through to do that. You can ferment salsa, pico de gallo, hummus. There's all kinds of things you can ferment. By the way, the addition of fermented foods like kimchi, kefirs, yogurts, not the stuff in the store, stuff you make with extended fermentation. Sauerkraut, pickles, all those things are incredibly wonderful. They are far more important, fermented foods, than a commercial probiotic. Not to say commercial probiotics don't have a role, but people tend to think, I just take this commercial and all my problems are solved. That's not the case. It's the least important thing. It does have a role, and especially if you take one of the more better informed, better formulated products. But in general, the most important thing you do for the microbiome is change your diet and resume consumption of fermented foods. We do something, for instance, called Saccharomyces boulardii sparkling juices. Juices are terrible for you. They're filled with sugar, but you can ferment it. So we take a capsule of Saccharomyces boulardii. It's a fungus. It's a cousin of Saccharomyces cerevisiae, used to make wine and beer. We take it as a commercial product. It's called Floristore. And you empty one capsule into any volume of juice, provided juice has no preservatives, no potassium sorbate or sodium benzoate. Let it sit. Now keep the cap very loose, because it's going to start producing huge amounts of carbon dioxide. You're going to see it bubbling after 24 hours sitting on your kitchen counter. Let it ferment for about 60 hours so that all the sugars are gone. And if, let's say, you ferment apple cider, you're going to have apple soda. Or mango juice, you're going to have mango soda with virtually no sugar left. Now, you get these super duper high counts because you fermented it of Saccharomyces boulardii. What does that do? Shrinks your waist, increases muscle. It protects you during a course of antibiotics. It protects your gastrointestinal microbiome. It helps rebuild the microbiome. Even though Saccharomyces boulardii itself does not colonize the GI tract, it has this kind of farmer function. In other words, it kind of cultivates the proliferation of healthy species. So one of the most important things, and fun and delicious things you can do, is that crazy sparkling juice.
Yeah, I've never heard of that. That's awesome. That's in our repertoire at home, is the Saccharomyces. So like that's definitely something I would be doing. And I just got into juicing. So like you're speaking my language right now. This is great. Little combo there. I love that.
Now I should mention, that's one microbe. There are many others.
Yep.
So, in other words, if you want to shrink your waist even further, let's ferment Lactobacillus gasseri. Dramatic effect on shrinking your waist. How about you have a new child and you want to make sure that child has good neurological development, is less prone to asthma and type 1 diabetes and autoimmune diseases and obesity and type 2 diabetes as a teenager? Let's restore Bifidobacteria infantis to that child, and that child will have a higher IQ. How about a woman who says, I'm sick and tired of vaginal infections and urinary tract infections? Well, restore Lactobacillus crispatus, the dominant microbe in the female reproductive tract. And what happens? You have less discharge, pain on penetration, infections, less candida vaginitis, and fewer urinary tract infections. It's incredible that a woman can take Lactobacillus crispatus orally. It colonized the vagina. How? There's no connection. There's contiguity. Is that what it requires? That is nearness in the perineum. So it colonized the vagina, and then it colonized the bladder. The bladder has a microbiome. Who would have thought, right? We thought the bladder was sterile. No, it's not sterile. It's meant to have a microbiome, and the dominant microbe is Lactobacillus crispatus. And if a young woman lacks that microbe, she's more prone to miscarriages, to premature labor. And we're talking about very serious consequences. So we are in the cusp of this new age. We are playing with microbes with astounding effects. And it's my prediction that I hope in one generation, not tomorrow, because you guys know, educating practicing physicians is like herding cats. It's very difficult. They're resistant to education. They're obstructionists to health. So people like you and me and others trying to educate people so that they know this today, not in a generation.
Right. Yeah. No, and I love that you're like out there, like putting this information out there, trying to gain new information, just do the research, do the studies, and further expand our body of knowledge versus just staying with what's the current accepted norm. And so the only way we're going to continue to advance is if we continue to learn and grow. That's just how it works. And that resistance to change, it's interesting. I mean, it's everywhere. And you can just choose to be part of it or not, is a simple answer.
Here's something relevant to your world. And so that formulation I talked about, combination of rotari at high counts, collagen peptides, hyaluronic acid. By the way, hyaluronic acid is endlessly interesting. A lot of ladies, they say, oh, don't talk about hyaluronic acid. I already know because I put on a hyaluronic acid serum around my eyes. And I've lost some of my crow's feet. And that's true. And then you wash it off at night, of course. So I asked these ladies, so you put hyaluronic acid serum you pay a lot of money for on your eyes. What did it do for the skin in your neck? or your thighs, your abdomen? Nothing, of course. What if you take hyaluronic acid like you were supposed to by eating brain and tongue and skin? You take it orally. You get body-wide increase in skin smoothness, loss of wrinkles, because it increases dermal moisture. It also stimulates production of collagen, and even more incredible. So hyaluronic acid is a fiber, but it's one of the few fibers sourced from animals, not from plants. Well, this fiber, hyaluronic acid, also causes a bloom in beneficial bacterial species in your gut. These are species like Faecalibacterium and Akkermansia that produce a fatty acid called butyric acid. Butyric acid reduces abdominal fat, reduces blood pressure, reduces blood sugar, makes better sleep, gives you more vivid dreams, and smooths your skin and reduces blemishes and sun damage because the butyric acid acidifies the skin. Healthy skin is acidic, pH about 4.5, compared to diseased skin like psoriasis, rosacea, acne, 5.5. Recall that the pH scale is logarithmic. 4.5, 5. That's a 10-fold difference. So the consumption of hyaluronic acid acidifies the skin, gives you better skin health, gut-skin axis. But anyway, but that same formulation, rhodori, collagen, hyaluronic acid, astaxanthin, is also, I believe, a joint disease modifying formulation. I worry about my children. They're older. They're your guys' age, like 30 and 32. My daughter's a pro tennis player. Well, their mom and aunt developed hip arthritis in their 40s. These are slender tennis playing ladies. These are not overweight ladies. These are slender tennis playing, and they had their hips replaced in their 40s and early 50s. I don't want my kids to have to do that. So what if you go to the doctor and say, hey, you guys know this better than I do. Hey, doc, what can I do to not have arthritis in 20 years? Nothing. Lose 10 pounds. Yeah, right. Or take ibuprofen? No, there's nothing. They have nothing.
Yeah.
Well, think about this. Rhodori via oxytocin stimulates production of cartilage components. Collagen taken orally increases joint collagen. Hyaluronic acid taken orally stimulates production of synovial fluid. Astaxanthin, the carotenoid, is a huge anti-inflammatory in joint space. So I think I may have also inadvertently created a joint disease modifying formulation that prevents. We have to do the clinical trial, of course, and I hope to do that sometime in the next couple of years. It's all about budget. To show that we can stop the progression of osteoarthritis.
That would be amazing. I mean, honestly, because then you can keep people moving and you can keep them moving more comfortably. And then it's just like, it's that whole cascade of effects that happens. So no, I absolutely love that. So Dr. Davis, all of your, the information that you are sharing with us, we're going to be tagging all of this in the episode description. So if you've been listening along and you're like me, when I'm on a run and I'm listening to a podcast, and I have to pause and try and type down some stuff down. So just everybody know, we're going to put a lot of information in the description. So that way you can come back to this information, because it's really, really good stuff. And Dr. Davis, thank you so much for coming on. I really appreciate Bobbie.
Oh, thank you, guys.
We
thank you for trying to
appreciate
educate people, because my colleagues are not.
Exactly. Yeah. And just if you're listening to this episode and you find this to be interesting and helpful information, then share it. Share this with other people and let them know, hey, there's other ways of looking at health and how our bodies function. And it doesn't have to be this wait and see approach. We don't have to wait until something isn't going well and that surgery or, long-term medications are required. Getting ahead of things is kind of the way to do it. And that would be the much better way to do it. So make sure you subscribe, all the fun stuff. And next week we'll be coming on with another episode. All right, everybody. Thank you.